and welcome to my presentation on HIV and AIDS and the implications for social work. The learning objectives for this presentation are to understand the effects of HIV and AIDS on micro, meso, and macro levels for social workers. HIV and AIDS are two disorders that overlap. HIV is a disease with no cure that attacks and suppresses the immune system. AIDS is an advanced version of HIV, and diagnosis occurs when a person has fewer than 200 T cells per cubic millimeter of blood. There are currently 3 stages of the disease: acute HIV, chronic HIV, and acquired immunodeficiency disorder, also known as AIDS. According to the CDC, approximately 1.1 million people in the USA have HIV. HIV and AIDS are spread through the transmission of bodily fluids. Children may be born with HIV via transmission through the placenta. Symptoms consist of fever, chills, rash, fatigue, ulcers, swollen lymph nodes, and muscle aches. The current treatment for HIV is antiretroviral medication, which can be pills or shots. While there's no cure, we can control the levels of the virus in the body through medication. Yearly routine blood tests help stop the spread of HIV and AIDS. Prevention consists of abstinence, condoms, and no sharing of needles. Most transmission of HIV stems from male-to-male sexual contact. The races that suffer the most from the disease are African Americans and Latinos. Male-on-male contact from African Americans and Latinos account for more than 14,000 of the new HIV diagnosis cases in 2020. The micro level of HIV and AIDS affects individuals and families the most. Side effects of HIV and AIDS can cause depression, anxiety, and sadness. Social workers at this level should provide mental health counseling and refer the client to any related services. At the meso level, HIV and AIDS may target vulnerable communities. Risky sexual behavior and drug use threaten to spread the disease further. Social workers should invest in forming educational groups and seminars to educate members in high-risk communities. Collaboration with federal agencies to provide free prevention tools at the meso level, such as free condoms, will help decrease HIV and AIDS. HIV and AIDS affects 33 million people globally. Costs associated with this disease amount to $28 billion a year. Social workers may push for policy reform to provide more funding to combat HIV and AIDS. The funding could strengthen health insurance policies and provide things such as educational services, prevention programs, incentives, and prevention tools to stop the spread of HIV and AIDS. With these tools in place, overall future health care costs may be lowered. One of the things I learned from this course was the differences in health insurance. I learned the basics of Medicaid and Medicare and what procedures may be covered and the criteria needed to qualify for these programs. Another area I learned was writing the federal government about policy change. Advocating for our clients is huge when promoting policy reform. One of the tools that I will use in the future is the information I gained regarding assessments. Understanding the requirements of a proper assessment will help me accurately diagnose future mental health concerns. I chose this subject because I feel that it is a disease that could be completely preventable if the proper tools and preventions were in place. I have a family member who has suffered from HIV for years. I feel that no one should have to suffer this disease. Funding, education, and resources may hold the key to us being an HIV-free world.